I'm going to be demonstrating some of the soft tissue techniques that I like to do for the thoracic spine now. So if somebody's coming in with the thoracic pain, we can just do standard kind of prone pressure just to kind of work on that area. Again, you're just making sure that I'm on the contralateral side from them. So the spinous process is right over here, and I'm just going to be kind of rolling over here just to help stretch that out, try to loosen them up. Now, notably up in the parascapular area, sometimes just because of the muscles kind of coming over here, kneading sometimes is a little bit more difficult in this area. I find that actually coming up to the head of the table and getting on each scapula, kind of falling down to that fascial layer and then stretching out over this way here and just kind of leaning into it, that tends to work a little bit better for just getting all those parascapular muscles. Okay, so I'm just going to do a little bit of stretching, a little bit of kneading, and then I'm going to be showing the leg lever technique in a little bit to be able to kind of get this, especially once we get just below that scapular kind of layer, or when we're probably about T4 and below, tends to be a little bit higher yield. So I'll be demonstrating that in just a second. Okay, now I'm going to be demonstrating the Clearfield Leg Lever technique. And so this is a technique that I came up with during my, when I was doing my OMM fellowship. And so when we're just trying to do soft tissue on somebody, and the thoracic spine, sometimes in the lumbar spine, sometimes you hit like that rib that's just really kind of, they're just tight. You're like, I'm trying to knead on it, I can't really get it, and then, it's difficult just to try to do any kind of manipulation on it. So let's say that I find a very hypertonic kind of area right over here, regardless of whether I have a diagnostic, a segmental dysfunction. Let's just call it hypertonicity of the mid-thoracic spine on the left side right over here. So I'm kind of on the opposite side from where I am. So what I'm going to do is with my cephalad hand, I'm going to put it kind of at the apex of where I feel all that tightness in the curve there. Then what I'm going to have him do is put his knees together, bend your legs up, okay? And then I'm going to move him so I feel the apex of that arch is right where my hand is now. And I'm going to come up on top, and then I'm going to use the legs as a long lever right here. So long lever is with my caudate arm right here. And then with my cephalad arm right here, that's my short lever. Okay, and so I can use it for just some soft tissue, just stretching, just to get a little bit more leverage on those paraspinals. Okay, sometimes you're going to hear a little bit of an articulation. Sometimes you might feel like a rib is kind of out and you need to kind of get it back in. And so I can either use my hypothenar eminence or my thenar eminence right on that rib to be able to kind of pop that rib back sometimes. And so you can simultaneously do that where you're kind of pushing down and kind of slightly pushing up right over here. So you can use it as an HVLA or articulatory technique. You can use it for muscle energy. And so I got them right over here. Go ahead and try to bring your legs back towards the midline here. Okay, and fire a little bit more. Okay, if you want him to use enough pressure that he's firing those paraspinals underneath your cephalad hand right over here, and relax. Okay, and then I can take him down a little bit further, stretch it a little bit further. Okay, and do that again, and relax. Okay, and then you can also use it for myofascial stacking. So saying that I want to try to get myofascial release on some of this tissue right over here. Okay, I can kind of say, okay, it likes to kind of go, I can look into rotation. Okay, so it likes to rotate a little bit to the right. Okay, it likes to move, and so I'm going to take it more into the barrier, so I'm going to move it into the left. As far as flexion and extension in the sagittal plane, it likes to go a little bit more into flexion, so I'm going to bring it more into extension. As far as side bending, okay, it likes to side bend more to the right, so I'm going to side bend to the left, and then I can use this to tighten up and kind of create a new fascial kind of restriction to see where does it like to kind of go. It likes to kind of relax a little bit over here, so I'm going to put a little bit more fascial tension on it right over here, and that should be able to facilitate a quicker myofascial release. So again, the leg lever technique, you can relax your legs back over here. It's a very versatile technique. As I'm doing this, I'm always trying to get feedback from the patient. I'm always talking to them. I always say mouths can lie, but faces can't. So I'm looking at their face, making sure they're tolerating it. And notably, as I get them in position over here, I always just check to make sure it's not hurting their feet, ankles, knees, or hips as I'm setting it up. And then making sure my pressure over here is not too much on them as I kind of get them in there, because it can put a big load right on that area pretty simultaneously. So just make sure you're not overwhelming the patient. So that's the leg lever.